Hi, everybody, and welcome to the Mind on Mental Health podcast. My name's Andy Dean. I'm a licensed clinical social worker. And today we're actually switching things up a little bit. I'm actually the one who's going to be interviewed today. And I'm being interviewed by Pete Maclearie, who is the site director at Princeton House Behavioral Health's Eatontown site. The reason why I'm being interviewed by Pete is because I recently wrote some psychoeducational curriculum for them to use in their new anxiety and mood disorder track in Eatontown, New Jersey, since I specialize in the treatment of anxiety disorders in my private practice. So I hope you guys enjoy the episode and find it helpful.
So one of the things that we've been working on at my location is the new anxiety program, which I appreciate your help on. When we were going through the curriculum, much like our trauma curriculum, we dedicated a day to this idea of like knowing your anxiety, right? Just understanding your anxiety. I think in a lot of our talks together, we've talked about how important it is for the patient to really understand like, what is going on for them. Care to share any of your thoughts? Because I feel like you and I have talked so much about this idea of like the patient understanding themselves, understanding their anxiety and their relationship back and forth.
Good question. How much understanding does a person need to have in order to feel better? Because I'll tell you, a common trick anxiety will play on people is to get them to try to figure out where this thing started or where it came from, right? And oftentimes people will come into the therapy room and they'll have kind of a preconceived notion of what therapy is supposed to look like. So they'll be saying, I'm trying to figure out where this started. Where did I start having this obsessive thought? Why did I used to be where my feet were all the time, and now I'm worrying nonstop. Like, where did that start? Where did that come from? Was it because I had that fight with my sibling when I was 7 years old, or was it because my parents weren't present enough, or whatever? Or was it because I had this traumatic experience, or this experience that I didn't like a couple years ago, and maybe it started around that time? Actually, do you remember what I was saying when I was struggling with this?
Did it have to do with the pandemic?
No, I had to put my dog down.
I do remember that,
Yeah,
yes.
and the worst, always the worst. But I remember that at that time, that felt like an answer to me for a while. Like, oh, I think maybe this started because my dog's name was Elliot. We had to put Elliot down at that time. And then I started just going down this road. And that maybe sort of satiated my anxiety or made me feel better for a little bit. But then I would have a thought like, but that doesn't really make sense because he died on this date. And then I remember my first like true intrusive obsessive thought started a couple months before that, right? So like that dog thing doesn't quite make sense. So really, where did it come from? Anyway, the point I'm trying to make here is that anxiety's number one job oftentimes is to put the spotlight back on itself, right? Like it wants to be your most important relationship. So I think about like that first girlfriend or boyfriend that you ever had, right? Like how infatuated you were at that time, right? What was your first girlfriend's name, Pete?
Angelica. If you're listening.
Oh, I just want to throw you under the bus. But anxiety very much wants to have the same relationship with you, where like you need to be thinking about it all the time. What's it doing right now? Where did it start? How can we make our relationship stronger, or how can I break up with it, or whatever? It always wants to put that mental spotlight of yours back on it. And one of the ways that it will do that is through thinking about your relationship with it. And oftentimes that can look like, where did this start, or where did this come from, right?
Yeah.
And then next thing you know, you're just back down this road of thinking about anxious content. Anyway, I think one of the things I do as a therapist oftentimes that will surprise people if we're working on this obsessive content is they'll come in and they'll say, I've been really trying to figure out, where did this start? Where did this come from? And I think maybe it was when this thing happened. And then I'll say, great, we got it. Now we don't have to think about it anymore, right? And they're like, what? Like,
sure, yeah.
You know, and I kind of do that to make the point that like this, no matter what answer you come up with to that question, there's always going to be room for anxiety to play, because who knows? Who could be 100% sure where this thing started?
Well, does it help too to kind of, help people understand that like the anxiety is like almost existing outside of language, right? Because it's like existing in your brain as like a right. Like,
I always say you and anxiety share the same brain. So you're probably a pretty creative person, right? Because anxiety is coming up with all kinds of creative ways that this thing can come get you. Absolutely. We want to kind of approach it as like you and anxiety share the same brain. We want to treat it like an annoying roommate. Actually, I'm going to give you one more analogy real quick. This is the analogy that I really like to use with my clients or patients. And if they're listening, they'll probably be rolling their eyes because I hear this all the time. And I'm not going to throw anybody under the bus since we're recording this. But we'll just say there's a person in my life who is very annoying to watch movies with, right? Because I'll be trying to watch, what's your favorite movie?
Pirates of the Caribbean.
Really?
First one only.
Okay. Pirates of the Caribbean.
I don't know. I've seen 4 movies in my whole life.
Okay. All right. Pirates of the Caribbean. I'm trying to watch Pirates of the Caribbean, right? And we want to treat anxiety like, I've had the experience before with a certain person in my life where I'm trying to watch a movie. They won't stop talking during the movie. So like, they might be saying like, oh, Johnny Depp, he's in this movie. He's been in this movie, and this movie, and this movie. Did you see this movie? Because it was really good or bad or whatever. And it's trying to like steal your attention away from this thing that you're trying to do, which is watch Pirates of the Caribbean. And instead of engaging with this person that's over here in your ear talking to you, trying to get you to engage with it, that's a trap we oftentimes get in with anxiety. We're talking to it in our head or engaging with it in our head, and that makes this voice louder, stronger, and come around more often, right? So the more we can kind of break this habit of talking back to this person while we're trying to watch the movie and just putting as much of our attention on the movie as we possibly can, that's kind of how we want to treat this, right? It's like an annoying roommate or someone who's really annoying to, say, watch movies with. And you have a choice in this moment because you can't really make them go away. And actually, it kind of wants you to try to make it go away because the more you try to make this voice go away, the louder it's going to get. So we just kind of want to say like, okay, it's here. I have a choice right now. I can engage with it, think about it, talk to it, argue with it, or I can notice that it's here and put as much attention as possible on the movie. And the funny thing that happens is like, the better you get at not trying to make this thing go away and just kind of letting it exist as you watch Pirates of the Caribbean, the best, the more this voice kind of naturally fades away on its own, right? But the more effort you put into arguing with it, trying to make it go away, the louder the voice gets and the more often it comes around.
Do you find that, so we talked about this idea of, hey, like help your client understand this relationship. Do they ever get ahead of themselves where they are like, I think I'm ignoring it. Okay, I should feel better, right? Like, that anticipation of like.
Yes. And that's why it's important to talk about goal setting in anxiety disorder treatment, which is that the goal isn't to make it go away. Because as soon as the goal is to make it go away, we're losing. Because it's like engaging with this thing, trying to figure out how can I make it go away. It's more about, and this is a huge point that I actually wanted to make, so thanks for reminding me, resistance. How can we limit our resistance to it? Because that's really the secret sauce to making this voice kind of get lower and usually kind of fade out, is the more energy I can put into getting rid of my resistance to it. I'm sorry, I should say that differently. The more I can stop resisting it, the more it tends to subside.
Yeah. Well, it's funny because like I have to itch my nose right now, and the more I think about itching my nose, right, it's like, oh my God.
That's a great example.
Right? And yeah, I think again, the number one thing that I think you've really illustrated.
Hang on a second. That's an uncomfortable feeling, right?
Oh, it's the worst.
It's the worst. Or I also think about like your foot falling asleep or something.
It just did.
Yeah. So it's super uncomfortable in the moment. And the important part is that we're resisting doing it, right? Like, what's ever happened to any anxious thought or feeling you've ever had?
What's ever happened to them?
Whatever happened to the feeling or the thought?
I mean, like eventually they go away.
Eventually it goes away without you having to do anything about it, right?
Mm-hmm.
So that's the attitude we want to take. Sorry for interrupting you. What were you going to say?
No, I think, again, the point that I just always want to help people understand is that idea of, it goes back to like discipline, right? Like you have kind of said, like, hey, there's a sense of discipline that you need to be able to sit with that itch and kind of ride the wave of like, yeah, this is going to itch like a lot.
Yes.
And I'm going to be okay with it itching, right? Which goes into the whole like ACT philosophy of, we're going to accept that this is going to itch and it's going to itch a lot, and I'm going to know that it's going to itch, and I'm not going to wait for that curve. I'm just going to try to not, right? I'm going to direct my attention elsewhere. I'm just going to take a breath. All those crazy thoughts of, I'm going to die, I'm going to do this, I'm just going to literally move my attention elsewhere, right? And it's, you just let that train go right by you.
Yes.
While you're standing right there.
Which is a super hard skill to learn and super frustrating at first, because your mind is so conditioned to go back to that thing that's dangerous.
But you're my witness. I have not itched my nose, and it doesn't,
You have not.
It does not itch anymore.
I'm very proud of you.
I mean,
I'm very proud.
it works.
The checking in with it.
Checking in with anxiety.
With anxiety. Like I was talking about the relationship before, and how like that first girlfriend or whatever, you probably had the urge to call them all the time. I wonder what they're doing, right? Where are they? Anxiety very much wants you to constantly check in on it and take the temperature and see what it's doing. Because that's a great way for it to pull you back into its tentacles and get you lost in whatever anxious content, right? Because it could be like, I wonder where my anxiety is at right now. Oh, great, I haven't had that feeling that I don't like in 10 minutes. What's gonna happen as soon as you have that thought?
White bear.
White bear. Oh my God, the feeling's back, right? So like, or similarly with the thought, it's the white bear thing. Oh man, when's the last time I had that obsessive thought that I really don't wanna have? Ah, damn it, it's here now.
Yeah, I always tell people it's kind of like when you get like a sore in your tooth, and then like every couple minutes you just like touch it to make sure it still hurts. And you're like, why?
And then as you do that, the sore like gets, it
yeah,
never
it's
heals.
Like, why am I doing this? I know it hurts, it's there.
Right. That's a really good example, because very much the same thing. So, and it's hard, like that habit of compulsively checking in with it, that's what it is, it's a habit. And like, it's a tough habit to break, but you can do it. You just...
Can I ask you, is it ever worth like teaching people why we've evolved to do that?
Of course, yeah.
Like, hey, like in theory, you know, if there was a bear in the cave, it's good to check 5 times because you don't want to get eaten. But
of course,
now we know that, you know.
Yes, and that's one of the first important things you say in psychoeducation, that anxiety is adaptive, and it's...
like learning how to resist what would be like a, you know, we call it like now a maladaptive skill, right? Like it was adaptive to a point, now it's no longer helping you, so we don't need to do it anymore.
Right. At a certain point, it's adaptive, but then at another point, it becomes maladaptive, and it's no longer helping us, it's hurting us, or it's stealing our attention, stealing our joy, making us constantly worry or be on guard.
And quickly, I don't know how much time we have left, but like if someone has something like a contamination fear and they're like, hey, I wash my hands too much, how do you help them regulate? Like, because again, we're talking about that idea of like discipline or like what is acceptable. Is there a way that you teach people like moderate checking in on anxious things? Or is it like, hey, you get one 15-second hand, like whatever, it's like one happy birthday song?
It depends. It depends. If we were doing true exposure response prevention for someone where that's an issue, I would say don't wash your hands.
Ever?
Yeah.
Okay.
For at least a while.
Oh, until like there's an idea like it'll break and then it'll be like an acceptable way to go about it?
It depends. It depends on the person, depends on the case.
So you're saying there's just people out there not washing their hands anymore?
There could be.
Oh man. Now I have OCD.
I think it really does depend on the case. But yeah, why do you, let's say I asked you to not wash your hands for a week.
I was just curious if there was a way to say like, hey, like I want to wash my hands after I go to the bathroom. Is there a way that I can do that safely within this? And it's like, yep, you get 15 seconds and that's it.
You can do that. You can do that. But what we want to avoid is doing anything in response to anxiety. So if you do that one wash and then you go watch TV and you get the urge to go wash them again because maybe you didn't get it quite clean, so anxiety is telling you maybe you should wash them again, then I would say do not.
So that's why that relationship to the anxiety is so important
Correct.
for the patient to understand.
Yes.
Yeah, okay.
What
Great.
does anxiety want you to do, and what do you want to do, right? Like that's the distinction to make. What are things you can do to make anxiety stronger, and what are things you can do to make yourself stronger?
Great, thanks.
All right.
Andy, thanks again for coming on. It's been super helpful having you today, and I've really appreciated picking your brain.
Thanks for grilling me.
You got it, bud.
Pirates of the Caribbean for life.